Breastfeeding. What is initiation of breastfeeding? It should start as early as possible and within first hour after birth. You can also give the child to the mother as soon as they are born with the umbilical cord attached. Exclusive breastfeeding. Infants only receive breast milk up to 6 months of age. That is your exclusive breastfeeding, that you are not giving any kind of top feeds. So, for 6 months is exclusive breastfeeding. Then it can continue up to 2 years. Up to 1 year, you can give combination of breastfeeding, but up till 6 months, exclusive breastfeeding. Correct latching position. So there are 4 points to be seen in correct latching position. First is that the mouth covers the areola. Second is lips are flanked out, eversion. Third is mouth should be wide open. And fourth is chin touches the breast. Correct latch on position for infant. Note, upper areola may be visible. Neonatal reflexes assisting breastfeeding. Rooting reflex. Nipple touches the mouth and initiates the reflex. Sucking and swallowing reflex. Rooting reflex. Stimulus touch around the mouth. Baby turns head towards the touch. Feeding in preterm babies. Gestational age at birth and method of feeding. Less than 28 weeks or baby, the gut motility is very less. So we give total parental nutrition. Between 28 to 31 weeks, you can give expressed milk and through nasogastric tube or orogastric tube. This is due to increase of risk of aspiration. After that, 32 to 34 weeks, you can give breast milk by pallidi or katori spoon. This is due to increased risk of aspiration as well. After 34 weeks, you can start with direct breastfeeding. Properties of breast milk. First, it has some immunological properties. You can remember it with the mnemonic PLAB. P is for para-amino benzoic acid. So it has low levels of para-amino benzoic acid, which protects from malaria. Second, L is for lactoferrin. Lactoferrin protects from E. coli. A is from IgA. It is the predominant immunoglobulin in colostrum. B is for bifidus factor. It promotes lactobacillus bifidus growth. And another B is for bile salt stimulated lipase. It protects from giardiasis. Epidermal growth factor EGF promotes intestinal maturation. It decreases risk of bacterial infection. Human milk oligosaccharides. Most abundant solid in breast milk is human milk oligosaccharides. It is a non-digestible substance prebiotic, increases favorable gut bacteria and decreases risk of diarrhea and necrotizing enterocolitis. Nutritional properties. Nutritive value 67 kilocalorie per 100 ml. Nutrient, you have your carbohydrates, proteins and fat in the breast milk. So carbohydrates are more in breast milk, while proteins and fats are more in cow milk. So, and even in that, proteins are 3 times more in cow milk compared to breast milk. So you have to remember that carbohydrates are more in breast milk compared to cow milk. Features. Carbohydrates. There are 6 to 7 gram per deciliter of carbohydrates, which is more than in cow milk. Then their carbohydrate lactose is converted to glucose plus galactose. Then you have galactocerebroside, which promotes myelination. Proteins. You have 0.9 to 1.1 gram per deciliter. If the protein is decreased, then there is decreased solute load on kidneys and it is renoprotective. Whey casein ratio is 80 is to 20, easily digestible. Amino acids, taurine and cysteine, it promotes brain growth. So these are the features. Different kind of proteins in breast milk. Fats. It is 3.5 to 4 gram per deciliter. It is rich in PUFA. For example, DHA, docosahexaenoic acid, promotes myelination. Cow milk is rich in casein. It coagulates in the intestine, forms curd, and it's not easily digestible. That's why cow milk is not easily digestible. Composition of breast milk. So there is one type of breast milk called colostrum, which is secreted during first 3-4 days. It is thick and lemon yellow colored. It is rich in 3A's. Colostrum is rich in immunoglobulin A. Colostrum is rich in vitamin A. And colostrum is rich in anti-infective protein, that is your lactoferrin. Second is your transitional milk. It is secreted after 5 to 14 days. It has increased sugar, it has increased fat, and decreased immunoglobulin and decreased protein compared to colostrum. So fat and sugar are more in the transitional milk, but immunoglobulins and proteins are less. Mature milk is secreted after 14 days. Preterm milk. Milk is secreted by mother of a preterm baby. So contains more, and then your mnemonic here is SIPs. So preterm milk contains SIPs. What is that? S is for sodium, I is for iron, P is for protein, and S is for sugars or calories. Then other type of milk is foremilk and hindmilk. Foremilk is what is produced at the initiation of feeding, and hindmilk is produced towards the end of feeding. Foremilk is thin consistency, hindmilk is thick consistency. Water is the main component of foremilk, fats is the main component of hindmilk. Function: foremilk quenches thirst, while hindmilk catches satiety and is energy dense. Foremilk is white in color and hindmilk is yellow in color. Continuing to deficiencies in breast milk. Micronutrients. What are deficient? In vitamins, vitamin K, D, and B12 is deficient. B12 is deficient in vegetarian or vegan mothers. Supplementation. How do you supplement these vitamins? So vitamin K, you give 1 milligram IM injection on anterolateral aspect of thigh. 0.5 milligram dose given if birth weight is less than 1 kg. So half dose is given if the baby is not even 1 kg. Vitamin D, 400 international unit per day orally up to 1 year of age is given by vitamin D. 400 international unit per day. Others like iron and zinc is not supplemented due to good bioavailability. Iron and zinc, it's not supplemented because it has good bioavailability. Supplementation of preterm breastfed babies. Birth weight and supplementation given. Birth weight is 1.5 to 2.5 kg. Supplementation given, iron 2 milligram per kg per day up to 1 year of age due to decreased stores and decreased bioavailability in preterm babies. So if the baby is 1.5 to 2.5 kgs in between this, then iron is given in the range like calculated as 2 milligram per kg per day up to 1 year of age. And this is due to decreased iron stores and decreased bioavailability in preterm babies. Then vitamin D, vitamin K, this is also given. So suppose baby is 2 kg. So you give 4 milligram of iron every day up till 1 year of age. Less than 1.5 kg baby, that is very, very low birth weight babies. In that, so let's see supplementation given in human milk. So preterm babies between 32 weeks to 40 weeks. In between that time, you give fortification, HMF. And then after 40 weeks, you give vitamin D, K and iron. Very important is contraindication of breastfeeding. Absolute breastfeeding, you cannot breastfeed when there is a congenital lactose intolerance, when there is galactosemia, when the mother is on chemo or radiotherapy. Relative contraindication, you have to think whether to breastfeed or not. That's in HIV. There are two risk factors. One is high and one is low. So this is about socioeconomic status. So if the HIV is in a high socioeconomic status, then you give formula feeds. But if they are from low socioeconomic status and have HIV, then you have to give breastfeeding because they won't be able to afford formula as well. Mixed feeding is completely contraindicated in HIV mother because of inflammation of the gut and easily transmission of the virus. And mother should be on antiretroviral therapy. If she is breastfeeding, she should be taking antiretroviral therapy. And then what is the prophylaxis for neonate? It is nevirapine. Baby born to HIV positive mother, you give nevirapine. Tuberculosis. If mother is untreated, treatment in less than 2 weeks, then she can breastfeed. If mother is untreated, treatment or cured within less than 2 weeks, then you can give it. Herpes, only if active lesions are present on for tuberculosis, if mother is untreated or cured in less than 2 weeks and it has been less than 2 weeks, then you cannot breastfeed. It has to be more than 2 weeks. Herpes, only if there are active lesions on the breast, then mother cannot breastfeed. Infections, avoid breastfeeding. How do you store breast milk? Room temperature for 6 to 8 hours, refrigerator for 1 day, in a freezer for 3 months. After that, you have to discard it. We will continue with malnutrition in the next video.